and good evening to all of them who are attending today's session. So let me introduce myself. My name is Dr. Sadia Qurrath. I have studied my BDS from Ambedkar Dental College, and I am currently working as a DCP in the UK. Today we will be talking about routes to registration in the UK, and I have my wonderful colleague and a batchmate who has studied along with me as well in Ambedkar Dental College, and also is working in UK currently. Let me introduce you to Dr. Basheeruddin.
Hello, Assalamu alaikum, everybody. I am Dr. Syed Basheeruddin. Sadia said we both are batchmates in Bangalore. So I finished my dentistry in the year of 2017. And as she said, I'm working as a dental care professional here in the UK as of now. I've been working here since past 1 year now, Alhamdulillah. So today's topic is about the routes of registration in the UK as a dentist. So if I can just start sharing my slides, can I?
Yes, Bashir, go ahead.
Am I audible, Sadia?
Yes, you are.
Are my slides see?
Yes, we can see your slides, yeah.
So yeah, as I told you, today's topic is about routes of registration as a dentist here in the UK. So this is for overseas dentists who've passed outside Europe, that is countries like India and Asia and all of the other countries. So there are two ways to which you can register as a dentist here in the UK. So you can undergo any of these two exams. You don't have to undergo both of them. Any one of them should be good enough. So the first one is the overseas registration examination. This examination is being held by the General Dental Council here in the UK. And the second exam, what I'll be talking about is the license in dental surgery exam that's being conducted by the Royal College of Surgeons here in the UK. So these are the two exams that you can take to fully practice as a licensed dentist here in the UK. So, yeah. Overseas registration examination is an exam that overseas qualified dentists, as I told you, have to pass in order to register with the GDC, that is the General Dental Council here in the UK. So as I told you, registrations allow dentists to practice dentistry unsupervised here in the UK. So you can work as a full-fledged dentist here in the UK, doing all the procedures that is under your scope of practice after you pass this exam. So this exam is held in two parts. Part one is designed to test the candidate's application of knowledge to clinical practice. It consists of two parts. Part A is the clinical part, the subjects what we study during our first, second, and third year of dentistry in India, the non-clinical subjects. So that's part A. And then there's part B as well, where the questions will be most probably based on your clinical scenarios, your final year subjects like the prosthodontics and all the clinical subjects what we study in the final year. So the exam is a multiple choice question based exam. It is part one is conducted in 2 days, part A on one day and part two the other day. So the part A will be the non-clinical parts, and the second day you go and give the exam for clinical dentistry. The other very important thing in part B is it includes the law and ethics and health and safety regulations here in the UK. So we are not familiar with these as foreign dentists, so we need to go through all of this before we sit for this exam. The exam is held currently only in King's College, London, and costs £806. So to book this exam, you need to make sure that you are here in the UK or you have a valid visa to come and sit for this exam here in the UK, because this exam is held only in the Royal College of, King's College of London. The cost for the exam is mentioned here, 806 pounds. Yeah. So currently, there's a change here. That's good for all of us. That's usually this exam had only 200 slots, but recently, very recently, the GDC, the General Dental Council, has increased those number of seats to 600 currently as of now. They might decrease it back to 200 later on once they don't need any more. But as of now, they've increased the number of seats from 200 to 600, and that is going to be started from this very next month. Actually, I think sorry, June 15th. That's going to happen there. So that's the change that recently that's happened, that's been done by the GDC, so that many people can sit for this exam. Because of the high demand of this exam, the number of slots were just 200, and previously we used to, I myself could not book the exam because of the demand, because how quickly these slots get filled. It usually gets filled within 30 seconds or 45 seconds. That's how rapidly these slots get filled. So it's very difficult to book this exam. So GDC has taken this step to reduce the demand. So that's one. So part two exam, again, it is held here in the UK. It is designed for candidates to demonstrate practical clinical skills. So all of this can be, you can find out about the learning outcomes and everything on this preparing for practice document. For each examination period, a maximum of only 144 candidates. So this part, the part two part, only 144 candidates can sit for this exam. And the current cost is 2,929 pounds. That's around close to 3 lakh rupees. So we need to be very well prepared to take this exams, as it is pretty expensive to sit for this exam. Um, Again, part two has different exercises. There's something called the OSCEs. They are the objective structured clinical examination scenarios, what we say as spotters, as you remember, we say spotters in India. So it's something very similar to that. It is, we have some actors who give us scenarios, and you need to do examination, clinical examination, do some radiographs, and then come to a conclusion and give a provisional diagnosis of what you think about it. And then there's some practical exercises that happen, and those are the cavity preparations, crown preparations, veneers, access openings, and all of that. And then you need to perform a medical emergency. A scenario will be presented to you, which you need to manage a medical emergency. So all these skills are being tested in part two examination. So this is the ORE part two. This is one of the exams. The next exam, what we see is the license in dental surgery. The license in dental surgery is the oldest continuously existing qualification in the UK, awarded by the Faculty of Dental Surgery by the Royal College of Surgeons of England. The award of this postgraduate qualification offers key benefits to the dentists worldwide. International candidates are eligible to apply for the registration. After you pass this exam, basically, you need to go back to the General Dental Council and prove with your documents that you've cleared this exam, and then you get registered, and you get added to the register here in the GDC, and you get a specific registration number as a dentist, and again you can start working as a dentist. So this is the second exam what I wanted to talk to you about. So these are the two exams. This exam is currently held only once a year, and this exam has a maximum of, I think, 120 seats for each exam. It is held only once a year, so that's the this thing. It's difficult for you to book the exam again. So to make these demands a little lesser, so the GDC has come up with increasing the number of seats for the ORE exam. But the license in dental surgery, the number of seats are still 120 as of now. Yeah, it is held only once a year. It have an online RC. You need to make an online RCS account. Then you need to submit with your documents. The RCS, that's the Royal College of Surgeons, will contact you for your documents. You need to have all of the documents. Again, basic documents like your IELTS scorecard, your internship completion certificate, your qualification of your dentistry qualification certificate, and so on. So once you submit all of this, they are going to add you to the list. And the exam is depending upon which part you're taking. The exam, you can book the slots either on the first come first basis or sometimes also by lottery system. So this is the license in dental surgery, also called the LDS exam. Again, part one of the license LDS exam is comprised of two papers. Again, single best answers questions. Both part one paper must be passed in one sitting for candidates to progress to part two, and you have a period of 5 years to finish the part two before after you finish your part one. So basically, that means after you clear your part one exam, you have a time period of 5 years within which you need to finish the part two exam. If you don't, then you will have to re-give the part one exam. That's what it means. Um, so yeah, this exam is held only once a year with only 120 slots. The fee for this exam is around £900. That's what's the fees as of now. And the maximum number of attempts that you can take to pass this part one exam is 4 as of now. Coming to LDS Part 2, this is an exam to check to assess your clinical skills. Again, it is very similar to ORE Part 2. Part 2 LDS will held 2-day period and consists of two sections. Again, OSCE is consisting of 12 stations, each of 7 minutes. Again, OSCE is something very similar to the spotters, what we do in India. There will be some unseen cases based on the objective structured long examination called OSLE model, which is designed to test the candidate's diagnosis, treatment planning, and clinical reasoning. It consists of 4 cases, approximately 30 minutes each. So, yeah, anything else? Yeah, for this exam, the LDS Part 2, you have only 3 attempts to pass this exam, and the fees for this exam is £1,575. So before, I think a year ago, this exam was also being conducted only in 2 parts. It was LDS Part 1 and Part 2, but very recently the Royal College of Surgeons have now made it into Part 3. There's a new part. They've distinguished into 3 parts now. So the new one is the Part 3, where you need to do booking again for this part. And the Part 3 exam of the LDS will be held over a 1-day period and consists of one section, 180-minute operative assessment on dental mannequin. Again, same clinical thing what I mentioned to you in the ORE, like cavity preparations, access openings, crown preparations, and stuff. So again, this exam also is around £1,525 to get the exam, to get a slot to write this exam. So these were the 2 exams that we wanted to discuss. So if any doubts, or should I go forward with this, Sadia?
Right. Bashir, go ahead with the next slides. In case we have any questions, I'll let you know.
Okay,
and
thank you.
if anybody actually has any questions, please put them in the chat box so we can address it at the very end of the webinar.
Yeah.
Bashir, go ahead.
So yeah, so these were the 2 parts, the 2 exams that we need to appear. We need to appear either of the 2 to work and practice as a dentist here in the UK. Currently, there is a lot of shortage for the dentists, so there is a huge demand of people all over the world trying to book these exams. The challenge to practice as a dentist is not just that you're good with your clinical skills and your theoretical knowledge, but you also need a lot of luck to try and book these exams. They are so in high demand that the slots usually get filled within few seconds. And even if you're lucky to book a slot, I know some of my friends who've taken 24 hours for the next page to load, and then you do the payment to register for that slot. So that's how demanding it is. Currently, the General Dental Council don't have the manpower to control this high demand. There was another very famous route which usually most of us try and get through, and luckily me and Sadia were lucky enough to get to the UK through this registration. But I'm very saddened to tell you that this route has been very recently been closed by the General Dental Council. So we cannot register as a dental care professional from now on. This was bought in action, I think in the month of March 2023, that's very recently, that the GDC have decided that any dentist from the outside of the Europe cannot register themselves as a dental care professional. This route was easy because you did not have to give any exams. You just have to submit some documents. You need to do some CPDs called the continuous professional developmental courses that you do online. And then when you prove that you are good enough to work here in the UK, they give you a registration as a dental care professional. Dental care professional means either you work as a dental hygienist or as a dental therapist. So a dental hygienist usually does the oral prophylaxis and very basic procedures like teeth whitening, some very basic procedures, whereas a dental therapist can do some fillings, some pedo crowns and stuff, and basic things. Usually it's basic things. But unfortunately, this route has been now closed because the dental care professionals who do the course here in the UK were losing jobs because there were so many people from outside the Europe who were coming here on this route and taking up their job. That's what they claim. And that's why the GDC decided that they are going to close this route. And now any dentist who is from outside the Europe needs to appear for any of the two exams what I mentioned earlier to work here in the UK. So this is an update that might sadden you. I'm so sorry about that. Okay, this is what I had. So yeah, this is all I had. There are some, one second.
Bashir, I think I'll take over from
Yeah,
here.
yes, please. Thank you. Can I stop sharing now?
I think, yes, you can stop sharing.
Yeah, for any details, for any contacts, please, this is my UK mobile number. If you want to chat with me, you can just contact me here. Thank you, GDP, for the opportunity, what you've given to me today. Thank you so much.
Thanks, Bashir. Thank you for all the information. That was actually very informative. I will be talking about a few more things. Can you see my slides?
Yes, we can.
Right. So there are few, there's another route that was planned by the UCLAN, that is the University of Lancashire in UK, this is for basically people who have already finished BDS. It's for international qualified dentists. They can actually enroll into this program, and they can appear in 4th and 5th year of that course. So it's an 18-month program that allows the overseas qualified dentists to enter the BDS course in year 3, and they will be assessed for year 4 and 5. But however, this route has not been subjected to approval. I mean, it's still not been officially claimed by the GDC that this is a correct route, or they have not given any approval on this. So this is one of the talked about route that people are interested in, but I think this is also going to cost you a lot. And also they say that upon successful graduation, the My Dentist is one of the leading dental practices in the UK, are going to give you an opportunity to work as soon as you graduate too. So this is one of the routes, but it's not been approved yet. Yes, and talking about job prospects in UK, Dr. Bashir has already told you about two routes, that is the ORE and the LDS. Now, what after ORE is the question. You can either work as a private dentist or work for the NHS. Now, what is NHS? It's a National Health Service. It's basically a government-run service in the UK, where you will be given to work as an NHS dentist. You need to undergo a training. It's sort of like an internship under somebody's surveillance or supervision, that you practice under them, and then they give you a certificate of that you can go ahead and practice however you want, whether privately or whether NHS. But if you're working privately, you can just directly start working. But if you're working under the NHS, you will first have to go a VT training and then work under the NHS. So other things that you can do with the ORE or LDS after passing the ORE or LDS is you either can do your research or you can apply for your master's, and you can do the master's here as well, work as a hygienist or a therapist, because obviously you are a dentist, you can work as either of these. But most commonly people work as a private dentist or an NHS dentist. Here are some of the important links that you would like to know. The first link is for the GDC registration, that is how you register for the ORE. The second one is for the LDS exams. The third one is the kind of jobs that you will find here in UK. If you just go click on the website, you will see the places or the clinics or practices offering the NHS jobs, and what could be the salary. I mean, you can just get an idea as to what is the salary and what is the demand for dentists actually right now in UK. And the very last link is for the UCLAN, the one I shared, the graduate, the undergraduate course that is being offered by the UCLAN. If you really want to know more about it, you can just head to these links and it will give you some more information on that. Yeah, so if you have any questions or queries, you can always message Dr. Bashir on this number or leave any questions on the chat so that we can address them. Yeah, that's all for today. Thanks. Thank you, everyone. Okay, so
yeah.
I think we have few questions. Somebody's asking again, fee for UCLAN in 18th month tenure. I think they have not put up the fees, but it says that it is around probably £70,000 per year. So I'm not sure, but this is what they yet to decide on the cost too. So it's quite expensive as well. Yes. Hannah asked, was the session recorded? I guess, yes, Hannah, you can find this recorded session on YouTube. And yes, it's been recorded for you. So I think people have some more questions as to how many times can you attempt these exams and things like that. Okay. I think Dr. Bashir, can you just address this question? Are you there, Dr. Bashir?
Yeah,
somebody's asking the benefits of MDS exams conducted by Royal Colleges. I guess it's not the route for registration, but they just want to know what is the benefit of having an MFDS exam or giving an MFDS exam. Yeah.
Yeah, thank you, Sadia. Exactly. It's not a route for you for your registration. You can't work as a dentist with passing the MFDS exams, but it gives an advantage over other dentists here. Many companies, many dental practices prefer somebody who has already passed the MFDS exam. So you stand out in that way. And it is a very honorable member of faculty of dental surgery, is a very honorable degree that you get from the Royal College of Surgeons. So in that way, it is a very good thing. So it makes your CV a bit stronger for you to get, a special sort of treatment, something like that. So yeah, it is an exam, but as you said, it is not a route for registration. You can't work here as a dentist after passing the MFDS. You will still have to work, still have to finish off with your ORE or your LDS exam.
Dr. Bashir, there's another question. Age limit for these exams?
As of what I know, there's no age limit because I know people as old as 50, 60 trying and writing these exams. So I don't think there's any age limit as of now. I'm not very sure about that. But yeah, I don't think there's any age for to appear for this exam.
And I think we have another question as to how many attempts is this exam? Like how many times can we attempt ORE and LDS?
As I told, ORE part one is 4 attempts and ORE part two is 3 attempts. So after you pass your ORE part one, you have a time period of 5 years where you need to sit for the ORE part two and finish the part two. If in case in those 5 years you're not able to pass the part two exam, then you would require to reappear for the part one. But basically, 5 years is a very long time. So most of the candidates usually do pass the part two exam before the 5 year period gets over. Also, if you are not able to book the slots after you've finished your part one and you are not able to get a slot to sit for the part two and the 5 year period gets over, then the GDC will add you to a list called the priority candidates, where you will get the priority of booking the seat before anybody else. So in that way, they make sure that you finish off your part two. But yeah, as for the number of attempts, ORE part one is 4 and ORE part two is 3. When it comes to LDS exam, again, LDS part one is 4 attempts, and part two and part three have 3 attempts each. Do we need coaching? Uh, it depends on how good you are with your clinical knowledge. Usually, what I have seen from my friends and my seniors who've already passed this exam, they say for part one, you may not require any coaching or any training, but there are a lot of online websites, online training institutes that give you training for part one and for part two as well. There are some uh, good companies here who train you for your part two clinical scenarios and all the exercises that you need to perform on the day of the exam. So yeah, there are some coaching institutes. As I said, it's how strong you are with your clinical and non-clinical knowledge. If you're not, then you might require coaching. If you are good at it, I think you can do it by yourself, because we are NEET exam is such a high demand exam, so I think it is almost very similar to NEET, or a little somewhat very similar. So it's up to how much knowledge you have, and then you can decide on that.
I think I would like to add a point there. Like you said, like Dr. Bashir said already, part one, you would not require much of coaching. It just the theory, you can just read and you can give the exam. But whereas part two, it is better if you can opt coaching, because they would teach you things from a UK perspective as to because you've never taken this exam, and because a lot of money is going into your part two exam, you would not want to risk that, but just give an attempt and seeing how it goes. It's better you take a coaching and see how things are performed from the UK, perspective. So there are a lot of organizations in India as well as in UK for you to practice. There's one based in Mumbai. I'm not sure of the name, but we'll just put it up if you need it. So yeah. Bashir, there's another question. How often these exams happen in year, ORE exams?
As I told you, ORE is conducted 2 times a year. So it is usually conducted in the month of April and then in August or September. So the ORE part one exam is held twice a year. Again, part two also twice a year. But the LDS exam is held only once. The part one exam is held only once, and that's usually in the month of April or May. So the bookings for these exams, usually for the LDS, the bookings usually is during the month of February. But again, as I told you, you need to have an account with the Royal College of Surgeons, and once you're in contact with them, you receive regular emails from them, and you get the updates about the exam date, when you need to book, what's the fees, and all of that. Once you create your account with the Royal College of Surgeons, then you are always up to date. Same with the GDC. Again, for the ORE exam, how often this exam happens? I told you it happens twice a year. Again, to sit for the ORE exam, before you sit for the exam, you need to register with the GDC. So you need to request, as Sadia shared those links. The first link was for the GDC, the ORE exam. So you need to request for an application form for the ORE exam. So the application form is sent to your email ID. And once you receive that, you need to fill the application form. You need to attach all of the required documents that's mentioned in the application form. And then you need to send that to the GDC. So currently the wait list is pretty much. So you need to apply as soon as possible. It may take anything between 3 to 6 months or even more for your application to get processed and then you being added to the list to sit for the ORE exam. You just can't open the link and then book the exam. You need to first register with the GDC. So once you're registered with the GDC, they check your documents and everything is fine. Then they add you to the list of the ORE list where the candidates appear for this exam. So only those candidates who are in the list can book the exam and then sit for the exam. I hope that helps.
Yeah, I think that has answered all the questions. Is there anyone who has any more questions? Right. Thank you, Nida. Thanks for engaging us in the chat. I think that's about it. Right. So I would like to thank everyone for joining us in this webinar and being a very engaging audience. I would like to thank Dr. Gausia, Dr. Nair, and everyone from the GTP for giving us this opportunity to speak about this. I hope this has given some picture for people who are aspiring to move to UK or have had any questions about it. And if there's anything that you would like to add on, ma'am, Gausia ma'am and Nair sir, please go ahead. I think it was.
I just want to add on one thing. Actually, the thing is regarding the ORE exams and the LDS exams. If you take the ORE exam, you cannot use the post-nominal letters ORE. But whereas in the licensure dental exam, after you finish the licensure dental exam, you can use the post-nominal letters after your graduation stating that you are LDS RCS.
Yes, that's right, sir. Yes. You can use it as a
post-nominal
accreditation or a
letters, just like
degree.
this
Yes.
is yeah.
Right. That's very. All right. So I think we would like to conclude this webinar. Thank you everyone for joining. I think you would you can also go back to the YouTube link we will be posting. It's been recorded. You can find the link there and you can share it. Or if you have any questions, you can always approach Dr. Bashir. The number is on the link too. So thank you everyone. Have a nice evening. Take care.